Hello, my name is Donna. Thank you so much for joining me today. This video is for nurses who are considering remote nursing, which is also virtual nursing, telehealth, telemedicine. And I first want to give honor and glory to God because without God, I am nothing and can't do anything. So I got to give Him the glory first. Today, I'm going to just talk to you a little bit about what I do as a remote nurse and then share some information about why I chose remote nursing and let you consider, is this something that could possibly work for you? And so, my position in remote nursing is a care manager. And I am based from home, but I do go out and I meet with clients. And basically, what I do is I help to make sure that they receive all the care that they need. I could have a client that is in the hospital or a long term care facility or at home, um, anywhere, or even in another state, because a lot of the work is done virtually, but then there are some visits that I may do in person if the client is local and I feel a need to do that. And so I chose care management because I like that role. There are about 27 different roles that a nurse can do virtually. And so when I was reviewing the different options, that's the one that really resonated to me. And I'm going to share with you why I chose that one. I like the fact that I still get to help patients, I still can interact with patients and families. I like that I can help them connect with services. And guys, it's so nice because what a lot of times what we take for granted, people just don't know, and they are so very thankful to get this type of information. Like my client that I was working with today, she moved here, which I'm in Texas. She moved here from California to be close to her son. And when he first contacted me, he was thinking she needed to go to an assisted living. But after I did the assessment and I saw that she needs intermittent help, and she can do a lot of things for herself, then I made the recommendation that she could go to an independent living community and have caregivers come in and also have home health because she needs physical therapy. And so I love doing that because, again, I'm still helping. She was so appreciative. The son was so appreciative because he was like, I just didn't know what to do. He said, I'm just so nervous. He said, that's my mom. I love her, but I just don't understand any of it. And so that's one of the things that I want nurses to really understand is we have a lot of experience and a lot of information that we take for granted, but it's very useful as a virtual nurse. It's very useful to insurance companies. It's useful to hospitals to be able for a nurse to take her experience and her knowledge and help patients get the services that they need. And so instead of taking care of just, the healthcare, which is what we do in a traditional role, we just make sure, they get their medicines, they get any treatments that they need. That's what you do in a hospital setting and also a doctor's office. But in a remote nurse setting, you're actually looking at the patient as a whole, and you're looking at everything that is impacting their health, and you just connect them with the right services, the right resources that they need. And so that's why I chose care management. There are, like I said, 27 different roles a nurse could do in remote nursing. And for those of you who are new and this is your first video, I'm basically sharing my journey with transitioning from bedside nursing to just remote nursing, working from home. And it has been a journey. There's a lot of little pieces of information that are very important if you are considering that role. And I want to also talk to you about the reasons that a nurse may choose remote nursing. The first advantage to it is that there are a lot of options. As I said, there's like 27 different roles that a nurse could do. And then another advantage is it's non-bedside care. So it is basically a lot easier. The work is much easier. How about happier? I'm happier doing remote nursing than I was with traditional nursing. The hours are flexible, and some jobs you are given a caseload and you can kind of schedule your caseload and so that you can finish earlier, or you can spread it out so that you can do part of it and then do another part later on if you have something else to do, kind of like in the middle of the day. So it's a lot more flexible than your regular traditional nursing job. It's a lot quieter. So if you're looking for, everything to slow down for you, like that's what I was looking for. I needed my life to just slow down and have more time for myself and my family. And another reason is that it's changing your perspective into more of a consulting role. So remote nursing jobs are really consulting. That's basically what it is. And I'm not going to go too much into that today, but I will do a video about more of what remote nurses do. And then also another reason that a person may consider a remote nursing job is because they want to prepare themselves for the future. You could be a nurse and, you're not burnout. You're not, tired of nursing, but you just want to know what's available for you. Remote nursing is a very good option. One study that I read said that 40% of nursing jobs are going to be work from home positions. 40%, that's quite a bit. And so I am so happy that I got involved in remote nursing now, and I'm learning a lot of information. I've learned a lot of information, and I'm going to continue to share with you. And so if you are thinking like, well, maybe this is for me, I have some more information that you can download, and it just kind of gives you some questions and answers. These are the top 10 questions that nurses usually ask before they even start the process of pursuing a remote nursing career. And so I have a free download right below the video, and it will answer those questions that most people want to know. And I don't blame you. I wanted to know too. I wanted to know more before I got involved and invested time. And also I am working on a course because I found out too along the way that work from home nursing is a whole different world, and you need to understand the process. It's definitely worth it. It's worth the time. It's worth the investment in yourself to really look at this and understand how it works. And so as I'm putting the course together, it will be available in the very near future. And if you are interested in getting that information, if you want to be notified, please click the subscribe button. And then that way you will know when the course is available. Also, if you felt like this video helped you, please click the like button. And thank you so much for joining me, and I hope you have a good day.